I am the chief of pediatric cardiology here for the Mount Sinai system, and I predominantly work at Mount Sinai Hospital. In the field of pediatric cardiology, we mostly care for children with congenital heart disease, which are defects that kids are born with due to malformations of the heart. Congenital heart disease is actually the most common birth defect in humans, affecting a bit less than 1% of the population. And these can be things like holes in the heart or even valves that are obstructed or leaking, and can also be even more serious problems for a child, such as those who don't even have 4 chambers to their heart. Some heart problems in children are very obvious, nearly from the moment of birth, as they may have lower than average oxygen levels, which can result in a bluish tint to the skin and mucous membranes that in medical terms we refer to as cyanosis. Other problems are not possible to determine except for a physical examination or a sonogram of the heart. A heart murmur is a noise that we hear with a stethoscope when a doctor listens to the heart during an exam. The only really way to know if you have a heart murmur is for a doctor to hear one during an examination. But it's very important to know that heart murmurs can be a sign of a problem in the heart, but more often than not, they're what we would call innocent, meaning that we hear something when we listen with a stethoscope, but there's actually nothing wrong with the heart. Some studies have suggested that if a cardiologist or physician listens carefully enough to a child, nearly half of all kids will actually have a heart murmur, again, a noise we hear when we listen. But we know, of course, that only a very tiny fraction of all of those children who have a murmur actually have anything wrong with their heart. There can be many symptoms, including color changes, particularly blueness to the skin that can be associated with low oxygen levels. Other symptoms can include things like poor feeding in a newborn or sweating with feeds in the infant. And finally, very poor growth, although a symptom of many different kinds of problems in infancy, can also be seen sometimes in children with congenital heart disease that's not properly treated. There are many different treatments for congenital heart disease, and which one is right for your child is highly dependent on what's actually wrong. Some children require as aggressive therapy as open heart surgery, and others can be treated with catheter-based solutions, which would avoid the need for surgery. It's also very important to remember that many congenital heart problems may resolve on their own, such as small holes in the heart, or even some forms of abnormal heart rhythms in newborns can self-correct over the first year of life. Though certain infections or toxins in a mother can potentially cause or perhaps enhance the chances of developing congenital heart disease in a child, the vast majority are believed to be due to genetic causes. Some of these we can test for, and others we're still investigating to identify the particular gene that's responsible for the problem that we observe in a child. Well, I'm certainly proud to say that our heart center can now care for children with a very large number of heart problems. Really, to my knowledge, there's not a heart disease that I'm aware of that we do not treat at Mount Sinai. As I mentioned earlier, the treatment options include anything from catheter-based therapies all the way to heart surgery. I'm really thrilled that we offer the expertise in our center to do what is in our belief to be the best thing for each patient, personalizing the decision for our patient's needs. I've worked in many centers and each has its own good points, but there are many unique features of the programs at Mount Sinai. But if I had to pick just one, I would say that what makes us most unique is the degree of integration between our services that really separates us. Whether it is our integration with our surgical team who works seamlessly with cardiology to provide optimal care, or the manner in which our pediatric patients seamlessly transition into our very large and growing adult congenital heart program, which is headed by Dr. Zaidi, I think the most unique aspect of our program is the way in which we view this field as a true team sport with many different players all working together to achieve the best outcome. And there are many examples of that in our program. Well, I just really want to say that I'm honored to work at the Mount Sinai Children's Heart Center. Having worked at most of the major centers in New York City. I'm often asked to compare them. And I often say that there are outstanding doctors at every one of the major centers in the region. But what makes me so proud to be part of this team at Mount Sinai is the percentage of truly outstanding cardiologists here. It's really unlike any other center in the city. I have never worked with a group of doctors where truly every single one is outstanding. This is a wonderful thing for our patients and that it ensures the very best care for them. But it's also inspiring for the doctors, such as myself, and keeps me on my toes. It's been said that it's always best to surround yourself with people who can raise your game. And that has certainly never been more true than the team of superstars that we really have assembled here at the Mount Sinai Kravis Children's Heart Center. We each inspire each other to become better every single day. And I think that has a very positive impact on the excellent and compassionate care of our patients.